While a colonoscopy is often touted as a life-saving procedure designed to detect and prevent colorectal cancer, it's crucial to understand the risks involved, some of which could lead to severe complications or even fatal outcomes. Awareness of these dangers can empower you to make informed decisions about your health and potentially save your life. A colonoscopy involves inserting a flexible tube equipped with a camera into the rectum to inspect the colon for abnormalities such as polyps or tumors. While the procedure is generally considered safe, it is not without risks. Complications can occur. In rare cases, these complications have proven to be life-threatening. The first risk is an accidental hole poked into the colon wall. One of the most serious complications of a colonoscopy is a perforation, or tear, in the colon wall. This rare but significant risk can have life-threatening consequences if not promptly diagnosed and treated. The colon wall is thin and delicate, making it vulnerable to injury during the procedure, especially when polyps are removed or the colon is already weakened by conditions such as diverticulitis or inflammatory bowel disease. Perforations can happen in several ways. Mechanical trauma during the insertion or manipulation of the colonoscope can cause physical damage, particularly in tight or twisted areas of the colon. During a polypectomy, where tools like snare wires or electrocautery are used to remove polyps, tears may occur unintentionally. Another cause is overinflation of the colon, with air or carbon dioxide to improve visibility, which can result in a rupture in especially fragile areas. When the colon wall is perforated, bacteria and waste material can leak into the sterile environment of the abdominal cavity. This contamination often leads to peritonitis, a severe inflammation of the peritoneum, which is the membrane lining the abdominal cavity. Symptoms of peritonitis may develop quickly and include severe abdominal pain that worsens with movement, fever, chills, nausea, vomiting, a rapid heart rate, and a swollen or rigid abdomen. If left untreated, peritonitis can escalate to sepsis, a life-threatening systemic infection that causes widespread inflammation and organ failure. The mortality rate increases significantly when these complications occur. Certain individuals face a greater risk of colon perforation during a colonoscopy. Older adults are more vulnerable due to weaker colon walls and other underlying health conditions. People with pre-existing conditions, such as inflammatory bowel disease, diverticulosis, or those who have undergone previous abdominal surgeries, are also at higher risk. Additionally, the likelihood of perforation may increase when the procedure is performed by a less experienced provider. Treatment for a perforated colon depends on the severity and timing of the diagnosis. If the perforation is detected during the colonoscopy, immediate action is critical. Small perforations identified early may heal without surgery through conservative management, including fasting, intravenous antibiotics, and close monitoring. Larger tears typically require surgical intervention to close the perforation and clean out the abdominal cavity. In severe cases, a temporary or permanent colostomy may be necessary to allow the colon to heal properly. If you're finding this information helpful, make sure to like and subscribe. To reduce the risk of perforation, patients can take proactive steps. Choosing an experienced provider is essential, as skill and expertise can minimize procedural risks. It is equally important to discuss your medical history with your doctor, including any pre-existing conditions or previous abdominal surgeries that could increase the risk of complications. After the procedure, it is vital to monitor for signs of trouble, such as persistent abdominal pain, fever, or changes in bowel movements, and report these symptoms immediately to your healthcare provider. In some cases, colon perforations may occur due to negligence. Improper handling of equipment or failure to recognize and address a perforation during the procedure are examples of medical malpractice. If symptoms of a perforation are ignored or dismissed, leading to delayed treatment, the consequences for the patient can be devastating. Seeking legal advice can help determine whether the injury resulted from substandard care and if compensation is warranted. Colon perforation is a rare but serious risk of colonoscopy. Being informed and vigilant as a patient can help reduce potential harm. Always weigh the benefits and risks of the procedure with your doctor and take immediate action if complications arise. The second risk is complications with sedation. The use of anesthesia or sedatives during a colonoscopy introduces additional risks that should not be overlooked, particularly for certain populations. Older adults and individuals with pre-existing health conditions are especially vulnerable to complications associated with sedation. As the body ages, its ability to metabolize and process drugs diminishes, leading to an increased sensitivity to the effects effects of anesthesia. Pre-existing conditions such as cardiovascular disease, respiratory disorders, or kidney and liver dysfunction can further amplify these risks, as the body's systems may already be under strain and less capable of handling the additional burden of sedative medications. In some cases, patients may experience severe adverse reactions to the drugs used for sedation. These reactions can range from mild to life-threatening, and may include symptoms such as dizziness, nausea, or a dangerously slowed heart rate. Respiratory distress is one of the most serious risks, as the sedatives used during a colonoscopy can depress the respiratory system, making it difficult for patients to maintain adequate oxygen levels. This risk is heightened in patients with underlying lung conditions, such as chronic obstructive pulmonary disease or asthma, as their baseline respiratory function is already compromised. Cardiac arrest is another rare but severe complication linked to anesthesia. In some cases, the medications can disrupt the electrical signals in the heart, leading to arrhythmias or a sudden cessation of heart function. This risk is particularly concerning for individuals with pre-existing heart conditions, such as arrhythmias, coronary artery disease, or a history of heart attacks. The combination of stress on the cardiovascular system and the body's reaction to sedation can create a precarious situation that requires immediate medical intervention. Allergic reactions to sedatives or anesthesia can also occur, though these are less common. Symptoms may include swelling, itching, a rapid drop in blood pressure, or anaphylaxis, a severe and potentially fatal allergic reaction. These reactions often occur suddenly and require immediate administration of emergency treatments, such as epinephrine or antihistamines, to stabilize the patient. The risks associated with anesthesia can sometimes be compounded by errors in administration or monitoring. Inadequate dosing or improper patient monitoring during the procedure can lead to oversedation, which may cause the patient's breathing or heart rate to dangerously slow. Conversely, undersedation can result in increased anxiety and discomfort for the patient, potentially leading to a traumatic experience. Proper training and vigilance on the part of the medical team are essential to ensuring that sedation is administered safely and effectively. While the use of anesthesia is often necessary to ensure patient comfort and relaxation during a colonoscopy, it is critical for patients to discuss their medical history in detail with their healthcare provider before the procedure. Physicians can tailor the type and dosage of sedatives to the patient's individual needs, minimizing risks while ensuring the procedure remains as safe and comfortable as possible. For patients with significant risk factors, alternative methods of sedation or even non-sedative approaches may be explored to reduce potential complications. The third risk is internal bleeding. While minor bleeding is relatively common after the removal of polyps during a colonoscopy, it is usually mild and resolves on its own without medical intervention. However, excessive bleeding can signal a more severe complication and should not be ignored. The removal of polyps involves cutting or cauterizing tissue within the colon, which can sometimes result in blood vessels being inadvertently damaged. In most cases, these small vessels clot and heal quickly, but if clotting fails or larger vessels are affected, it can lead to significant and prolonged bleeding. Excessive bleeding, known as post-polypectomy bleeding, can occur immediately during the procedure or may develop hours or even days later. Immediate bleeding may be noticeable to the medical team during the colonoscopy, allowing them to address it promptly with measures such as cauterization or the application of a specialized clip to stop the bleeding. However, delayed bleeding is more insidious and often presents after the patient has returned home, making it more difficult to detect and manage. Symptoms of delayed bleeding may include bright red blood in the stool, black or tar-like stool, indicating digested blood, or dizziness and weakness due to blood loss. In some instances, undetected internal bleeding can progress to a critical level, especially if it remains unnoticed for an extended period. Significant blood loss can lead to anemia, characterized by fatigue, pallor, shortness of breath, and a rapid heart rate. In extreme cases, the loss of blood may cause hypovolemic shock, a life-threatening condition in which the body cannot maintain adequate blood flow to organs and tissues. This can result in organ failure and requires immediate emergency care, including intravenous fluids, blood transfusions, and potentially surgical intervention to locate and repair the source of bleeding. Certain factors can increase the likelihood of excessive bleeding after polyp removal. Larger polyps, particularly those with a wide base or located in difficult-to-reach areas of the colon, pose a higher risk because they require more extensive removal techniques. Patients who are taking blood-thinning medications such as aspirin, warfarin, or newer anticoagulants are also at greater greater risk, as these drugs interfere with the blood's ability to clot. Additionally, individuals with underlying clotting disorders or chronic conditions like liver disease may experience impaired clotting and are more prone to complications. Preventing excessive bleeding starts with careful preparation and communication. Patients should provide their healthcare provider with a complete list of medications and supplements they are taking, as some over-the-counter remedies, such as non-steroidal anti-inflammatory drugs or certain herbal supplements, can increase bleeding risk. Based on this information, doctors may recommend temporarily discontinuing certain medications before the procedure. During the colonoscopy, experienced practitioners use advanced techniques and equipment to minimize the risk of bleeding, such as applying hemostatic agents or clips to seal blood vessels during polyp removal. After the procedure, patients must be vigilant about monitoring their recovery and recognizing warning signs of complications. Noticing even small amounts of blood in the stool is not unusual, but large amounts, particularly accompanied by dizziness, weakness, or abdominal pain, warrant immediate medical attention. In some cases, follow-up testing or imaging may be needed to identify the source of bleeding and determine whether additional treatment is required. The fourth risk is infections. Though medical facilities adhere to stringent sterilization protocols, there is always a potential for human error or lapses in proper procedure, which can lead to improperly sterilized equipment being used during a colonoscopy. When these lapses occur, patients can be exposed to harmful pathogens such as hepatitis C, a viral infection that can cause chronic liver disease, or E. coli, a bacteria that can lead to severe gastrointestinal illness. These infections can have devastating consequences, as patients undergoing a colonoscopy are often in a vulnerable state, particularly if they are older, immunocompromised, or already managing chronic illnesses. Contaminated endoscopes or tools used during the procedure can serve as a direct pathway for these pathogens to enter the body, bypassing the natural defenses of the digestive system and causing localized or systemic infections. The repercussions of such infections can be severe and long-lasting. In the case of hepatitis C, a patient may not experience symptoms immediately, as the virus often has a prolonged incubation period. This can delay diagnosis and treatment, allowing the infection to progress to advanced liver damage or cirrhosis over time. Similarly, exposure to bacteria like E. coli can result in acute symptoms, including severe diarrhea, abdominal cramps, and dehydration. In the most extreme cases, complications such as hemolytic uremic syndrome, a life-threatening condition that can lead to kidney failure, may develop. Beyond the immediate health risks, these infections can have a profound psychological and financial impact on patients who may require prolonged hospitalizations, additional treatments, and ongoing care. Ensuring that medical facilities uphold strict sterilization standards and regularly audit their protocols is vital to protecting patient safety and preventing these preventable but potentially life-threatening complications. Medical malpractice is a growing concern. Medical malpractice related to colonoscopies is a concerning reality. Patients may face harm due to inadequate training, negligence, or improper technique by the healthcare provider. Instances of perforations or missed diagnoses are among the most common causes of malpractice claims related to colonoscopies. Some patients, despite undergoing a colonoscopy, have had precancerous polyps overlooked. This can lead to delayed treatment, which may allow these polyps to develop into cancer, undermining the very purpose of the procedure. Such missed diagnoses can be devastating, as early detection is critical in preventing colorectal cancer and improving long-term outcomes. Failure to properly sanitize equipment during a colonoscopy can expose patients to harmful infections. Improper sterilization may lead to the transmission of dangerous pathogens, including hepatitis C or E. coli, which can cause severe or even life-threatening complications. These infections are entirely preventable when proper protocols are followed, highlighting the importance of ensuring that medical facilities adhere to the highest standards of hygiene. Inexperienced or negligent providers may inadvertently use improper techniques during the procedure, increasing the risk of complications such as perforations. A perforation in the colon wall can result in emergency surgeries, prolonged hospitalizations, or permanent damage. The likelihood of these issues increases when the provider lacks the necessary experience or training, emphasizing the importance of choosing a qualified and experienced practitioner. Understanding your options and advocating for yourself are essential steps in minimizing the risks associated with a colonoscopy. Researching your healthcare provider is crucial to ensure they are experienced and operate in a reputable facility with stringent sterilization protocols. Discuss Discussing the risks and benefits of the procedure with your doctor beforehand is equally important. Make sure they are fully aware of your medical history, current medications, and any specific concerns you may have. Depending on your risk factors, you may want to explore less invasive screening alternatives, such as a stool test or CT colonography. These methods can provide valuable insights without the potential risks associated with a traditional colonoscopy. After the procedure, staying informed and vigilant is key. Be aware of warning signs of complications, such as severe abdominal pain, fever, excessive bleeding, or difficulty breathing, and seek immediate medical attention if they occur. Taking these precautions can help protect your health and ensure that any issues are addressed promptly. While colonoscopies can play a role in colorectal cancer prevention, it is essential to approach the procedure with caution and awareness. Understanding the potential risks, as well as your rights as a patient, can help you make the best decisions for your health. If complications arise, don't hesitate to consult a qualified medical malpractice attorney to evaluate whether negligence played a role. Your vigilance could save your life. If you found this information helpful, make sure to like and subscribe and share it with others. Thanks for watching.